Proton therapy is the most advanced method of radiation therapy used to destroy cancer cells, and the team at Hampton University Proton Therapy Institute has made significant strides in using proton treatment for breast cancer. Joining us now to tell us more is Donna Sternberg. She's the Director of Clinical Operations at Hampton University's Proton Therapy Institute. Donna, welcome.
Thank you. How are you this morning?
I'm well, thanks, and I'm happy to be talking about the fact that this very effective treatment now has an application for breast cancer.
And we actually have offered treatment for breast cancer patients for quite some time now.
What makes a good candidate, though? Because not all breast cancer patients need radiation. So is this something that can be used for any patient who needs radiation, or are there factors that would make it more effective?
Therapy, as you've already said, is a type of external beam radiation therapy and utilized in the treatment of patients with breast cancer on a frequent basis. Breast cancer is a complicated and diverse disease. It does not, they're not the same. There are many different types of breast cancer, and there are different stages of diagnosis. But oftentimes for women, they will receive therapy from both a surgeon, a medical oncologist, and then a radiation oncologist. And radiation oncology is obviously where the Proton Center could be a radiation choice for women.
Is there an order to treatments that is important? Because as you mentioned, no two breast cancers are exactly alike. There are many different kinds out there, and there are different ways to treat them. So can proton therapy be used along with other treatments?
Yes, as a matter of fact, it is again, as a type of external beam radiation, often fits into the overall treatment plan of a patient with breast cancer. Some patients with breast cancers will receive chemotherapy prior to a surgical intervention. Some people go directly to surgery. Radiation therapy of any kind, proton included, comes into play after the primary surgical intervention has been completed, whether that is a lumpectomy or a mastectomy, whichever surgical intervention is appropriate for the patient. The radiation therapy then is delivered after that intervention is completed.
Mm-hmm. Well, one of the reasons that we've been talking about this institute and proton therapy in our area for 10 years now is because it does seem to improve on being very targeted. Can you tell me a little bit more about that and what breast cancer patients are seeing as the benefit to using proton therapy versus other kinds of radiation?
Yes, well, the proton beam is able to be programmed to reach a specified depth and therefore not expose contralateral tissues to radiation therapy that don't need to see it, such as the heart or the lungs in the case of a breast cancer patient. There is a sparing effect of being able to reach that specified depth and not expose those normal tissues to radiation therapy that frankly don't need to see it. Mm-hmm. So that would be the reason that a woman of any type, or young women specifically, may choose to seek out a proton radiation therapy over conventional radiation therapy, specifically to minimize any exposure to the normal structures.
So how does it feel during the treatment, and then what is the recovery like between treatments?
Well, the treatments themselves are a daily treatment. On average, they're 4 to 6 weeks worth of daily radiation, Monday through Friday. We book patients every 15 minutes, so the actual duration of the treatment on any given day is quite short. For breast cancer specifically, very few side effects, if any. There is some skin irritation, as there would be with any radiation therapy. But in general, our patients are able to continue their normal activities with no interruption and no side effects. I often wonder, some people do get fatigued at the end, but I wonder if they're just tired of coming in or if it really is the treatment. So.
Yeah, it's good to hear the treatment itself seems to be kinder and gentler for the patient. We really appreciate your time, Donna. Thank you so much for making time for the Hampton Roadshow.
You're very welcome, and have a nice day.